Pharmaceutical prices are skyrocketing, especially the cost of specialty drugs used to treat incurable diseases like MS, hepatitis C, and cancer. A Mayo Clinic publication says the average price of cancer drugs for about a year of therapy jumped from between $5,000 and $10,000 before 2000 to more than $100,000 by 2012. Tonight, in a story you will see only on CBS 2 News, I show you some of the reasons for the sharp climb in cost, a resource for help, and a very resilient retiree.
It's just like somebody gave you a good kick in the gut because it just knocks the wind right out of you.
LaVon Heiberger vividly remembers the day in 1985 when she first learned she had breast cancer. Not willing to take chances, LaVon immediately had a modified radical mastectomy, followed by radiation and hormone treatments. LaVon beat the cancer. Or so she thought.
Here, open up, say no mouth sores.
15 years later, it returned with a vengeance, not only in her other breast, but her lungs and bones.
How are you doing with your shots? Doing okay?
She's been on various drug therapies through the years, and right now is taking Ibrance.
The cost of this one is pretty similar to the other one, which was like around $10,500, which would be my out-of-pocket expense for a 3-week supply.
That breaks down to $500 per pill. In addition, LaVon gets monthly injections of Foslodex at roughly $5,000 a pop. But if not for this therapy,
I don't know that LaVon would still be with us. It's keeping her alive.
Dr. Wilbur is well aware of the high prices for cancer drugs, sharing with me the annual cost of some other drugs used in oncology, from $60,000 to $120,000. She says one reason for the astronomical prices is there simply isn't as much market competition for these drugs as there is for medications that treat common, less life-threatening illnesses.
You have 10 blood pressure pills, so they all have to kind of compete against each other on price because you're only going to need 1 or 2. Even though there are perhaps several drugs that can be used for, say, metastatic colon cancer, eventually you're going to need every single one of those drugs. So there's not that market competition to drive the prices down.
That should be fine.
The pharmaceutical companies say they need to charge high prices to recoup the money they invest in research and drug development. But many question what that level really is.
You have drug companies that are pushing their prices up to as high as $30,000 a month for a drug treatment. Not because that's truly what it costs them, but because they're testing the limits of how far they can push those drug prices.
Another contributing factor, the powerful pharmaceutical lobby in Washington influenced legislation that forbids Medicare from negotiating drug prices.
The lobbyists were able to get that through on behalf of the pharmaceutical companies. And frankly, because of that, people who are setting the prices for these drugs for Medicare are really the drug companies, the drug distributors.
Dr. Wilbur also says that drug companies have become experts in extending their patents to keep drugs from going to cheaper generic versions.
When the drug is supposed to be coming off patent, they'll tweak a formulation, they'll tweak an indication, and they'll be able to prolong the time that it's on patent.
Fortunately, there is financial help available.
We actually meet with the patient before the doctor ever meets them.
As a patient financial advocate at Mercy Medical Center, it's Young's job to find co-pay assistance for patients like Heiberger. And her biggest resource? Foundations, funded solely or in part by the pharmaceutical companies.
We would not be able to help as many patients as we do without the help of the pharmaceutical companies.
They're coming directly through the drug manufacturers themselves or through foundations, which are getting a lot of their money from the drug companies. And I understand the pitfalls of that, but I also understand that we have to do what we have to do to get help for these patients right now. And if that's, if that's what's available at this point, then that's what we'll do to get help for these patients.
Knock on wood, I don't have to pay anything, which is a blessing.
Heiberger says she knows that drug companies have an awful lot of control, and it's frustrating. But facing what she's facing, this 72-year-old grandmother remains grateful.
If we didn't have the assistance to help with this, I probably wouldn't be here talking to you today.
Both Mercy and the UI say they can usually help most patients with financial assistance, but there are those who either don't qualify or fall through the cracks. Experts say in a for-profit healthcare environment, perhaps the most effective way to encourage change is through grassroots advocacy. We have a resource with a lot more information about this issue. There's a link from this story at cbs2iowa.com.